Hello, welcome back. The video topic today is how to tackle food craving after bariatric surgery. So bariatric surgery is a weight reduction surgery. That's simply to say where the stomach size, the stomach capacity has been reduced. So people with obesity usually they eat a lot, the calorie is very high, that's why they gain weight. Now to reduce the calorie intake and malabsorption, we have reduced the stomach capacity. So for all these years, they've been habituated to eat morning this much of food, afternoon this much of food, night this much of food. Whether they want, they need, no, they have to eat. Then only they get the satisfaction. So then only they can stop eating. Now, suppose after the surgery, if you have a food craving, that means you are not mentally prepared for the surgery. Maybe you are in a hurry and you did the surgery. So first and foremost, I always say, before going to the surgery, discuss with the surgeon, what are the things happen after the surgery, and you should be mentally prepared. So like usually, suppose you have this much a portion of food before the surgery, probably after the surgery you'll be able to take only this much portion. So this is very important. They think I'm eating less. No, this is what you need, this is what your body requires. So this amount of food is enough for your body, and this amount of food can satisfy your brain. So this is the beauty of this surgery. So mentally, I always say, weight reduction journey is a teamwork and it's a long process. And the surgeon is the captain, and maybe the patient is the vice captain, and we need some other players like friends, family members, and other nutritionists. Everybody are like players. So we need to know when to ask for the opinion. So mentally, they should be prepared before the surgery. This much of amount is enough for your body. That's what your body requires. So mentally they should be prepared, number one. Number two, after the surgery, usually because of the surgery, first 2 to 6 weeks, absolutely their appetite will be very less. They don't feel like eating at all. And moreover, they will be losing a lot of weight. So they will be so more happy, enthusiastic. They are losing weight. So they will be least bothered about the food. But after 3 months, after 6 months, the weight reduction will be slowing down. And probably after 6 months, and usually the food craving, if they are not well prepared, may come back again. So usually they will eat high calorie diet, stress eating or emotional eating. They open the fridge after 9 o'clock, they eat a lot of food. This can happen. Then what to do for that? First and foremost, I always say is, after the bariatric surgery, eat slowly, chew properly. Spend 25 minutes for each food. So you have to masticate, you have to chew the food in the mouth itself, so that the saliva secretes. This saliva can help to stop your craving, number one. Number two, instead of 3 meals, make it 6 meals, small food, maybe every 2 hours, 3 hours, small food. So always there is some food in the stomach, so you won't feel hungry or you won't feel that craving. Then we keep sipping water. Water always acts as fuel to burn the fat. Not only that, it also dilutes your acid and it fills your stomach. So the craving will come down. So keep sipping water. Then next is take a balanced diet. So balanced diet is very important, because balanced diet is healthy, and if you have a healthy mind, definitely the craving will be low. And don't keep long hours of fasting, or don't get into heavy hungry. Don't allow your body to go for severe hungry. Suppose you take breakfast 7 o'clock, 8 o'clock, and till 2 o'clock afternoon, 3 o'clock, if you don't eat at all, your body will be in severe need of food. So they can crave for food and they'll start eating. Once they start doing this, then they'll be habituated to eat more. So this is very important. So don't allow your body to go for hunger or fasting. Then whatever you eat, whatever the calorie being given to you, keep your protein level very high. Protein is satisfying. Protein is filling. So if you are full, then the craving will not happen that much. And you always say 80 to 85% of your calorie should be from the protein. So you should aim for that. And not only that, take adequate nutrients. Suppose if you're anemic, your body may ask for more food and craving. So take all nutrients. Check your anemia. This is very important. Then they should know. Most of the time, the bariatric surgery people, they don't discuss the surgery with their friends, family. So they have to tell them. So I have undergone a surgery for weight reduction, and they can help you. Suppose you are over indulging in food, they can tell you, oh, stop eating, so no, don't do this, we will help you. Or this is very, very important. You have to discuss your surgery with everyone, at least in and around you. This is very, very important. Then when to ask for a help, this is very, very important. Suppose you have friends, family members, and you have the a craving, you can call somebody, you can talk to them, they can help. Just talking for 10 minutes, that can divert you, and they can also help you with, suppose, for the stress you are eating, then they can help you for the stress, to alleviate the stress. So these are the main things you can do. Then they should know when to ask for a professional help. Suppose in spite of all these things, you are lost weight, and after sometimes you have tried everything, but you are not able to stop craving, probably you can go for a counseling. So that can help you, so the stress part can come down, the craving also come down. So bariatric surgery is a wonderful surgery where the stomach capacity is reduced. So with small amount of food, you can satisfy the brain. And this small amount of food is what you require. So don't think I'm eating less. You are eating adequately. Thank you.